Okay, hi, I'm out of the frame, but that's okay. This next test is the Dynamic Visual Acuity test, or the DVA. For this test, we're going to be using an eye chart called an ETDRS eye chart. What's unique about these is that they have the same number of ototypes on each line, so same number of letters, which is different than like your classic Snellen chart you might see at the eye doctor. And so for this test, Tina is going to be seated here, so we'll be over here together. And what this test does is it compares the patient's visual acuity, so how clearly they can see when their head is still compared to when their head is moving, which is a function of the VOR, maintaining gaze stabilization while your head's in motion. And so first I'll ask Tina to read the lowest line that she can.
So I can read DVOHC.
Okay, try the next one.
OHBCK. HZCKO.
Okay.
I can't read
And then the last. Okay, so she made it to line 9 on the eye chart. You always want to make sure that your patient is not able to read the very last line, because then you're not getting their true acuity. So then that's the first part of the test. We note for static vision, she can get to line 9 on the eye chart. And now we're going to ask her to read it while I'm helping her move her head. So important things, we're going to have her flex down 20 to 30 degrees, and then I'm going to be moving her head side to side. And Tina, I'm going to have you start on line 3 for this test. Okay. All right, so best you can. Here we go.
CZSHN, ONVSR, KDNRO, ZKCSB, DVOHC, OHVCK, HZCKO, and I think it's H blah blah.
All right, good. Yeah. So she only lost one line. She got to line 8, and her static visual acuity was at line 9. Some key things, if it's 2 lines or less that are lost, that's a normal test. Greater than that is abnormal. And then another thing, Tina did a nice job. She kept her head nice and loose. But if patients start to guard and you feel yourself having to move, then you're going to stop the test there and call that line. The other thing for this test to note, the way we name the line that they're at is the last full line that they were able to read, right? So you can see it in the video. This third one here, if they could fully read this entire line, CZSHN, then great, they got to line 3. But if they only got CZ and then they said W, then we're going to go up to 2 and call that the last line that they read. So that is the dynamic visual acuity test.